as you know the basics of your heart, that I would call this as my heart, which is a, just ignore my drawing. So let's see, this is heart. And now since you know that this is gonna be your right atrium, this is my right ventricle, and this is my left atrium and left ventricle. So there is this valve present here, and there's a valve present here, and again this right ventricle will be opening into the pulmonary part, where there will be another valve present in here, and there will be, this will be, the left ventricle will be opening into the aorta, where there will be another valve present here. But our focus mainly over here is being focusing on this valve right here. So as you know, the valve over here is your mitral valve, or the mitral valve, whatever you would like to call it. It is also known as the bicuspid valve. So when I teach, I go into very much depth of understanding the pathophysiology. So if you understand the physiology, you understand the pathophysiology. So this is the bicuspid valve. So as you know, this valve is going to have two cusps, something like this, where the blood will be flowing through this, and there will be only two cusps as compared to the tricuspid valve, which will be having three cups. So when I talk about this valve, when the blood, now normally what happens is that the blood flows from these, so I'm just going to draw it like this. So let's say this is my left atrium and my left ventricle. And you should be knowing this. You should be knowing that the left ventricle goes into the aorta, and the aorta goes into the body. It's very simple. So the normal blood flow is taking place exactly in this direction. The blood flows from this direction to this direction to this direction and to this direction. This is exactly how it takes place. So if I say that the valve would be allowing, now since this valve is bicuspid valve, this valve allows only a single direction of the blood. So if the blood flows from here, there's no possibility for the blood to go back into this opposite direction. That's something that you should understand. Okay, so this is one. And also sometimes the valve can be very, very small. So if you have a big valve, a lot of blood can go in, right, from one place to another. But if you have a very small valve, for some reason the valve is supposed to be like normally like this, but let's say instead of that the valve is like this. So will a lot of blood be able to go through this? No. So what happens in mitral stenosis is that this valve is very, very, very small. So if it is very small, it's very, like, close, like it's very narrow is the right word that we are looking for. So if this is very narrow, the blood is not being able to flow from from the left atrium into the left ventricle. So if the blood is not flowing from the left atrium to the left ventricle, the left ventricle will not have a lot of blood in here. So the blood over here is less, and if it doesn't have a lot of blood, the body, the aorta, will not get a lot of blood. So what happens if you know basically that the more blood flowing through into your aorta is going to increase your cardiac output? What does cardiac output mean basically? Cardiac output is basically nothing but your blood volume. So the more blood you're being able to send from the left ventricle into the aorta, the more cardiac output you will have. But if you have less volume going through the aorta, then there is very less cardiac output. So your cardiac output goes really, really, really low. Now, if your cardiac output goes really low, now if you remember, your heart has these muscles over here, these muscles which are surrounding the heart. Okay, this is not exactly how it looks like, but I'm just showing it to you. And these are your cardiac, this is your coronary supply, the coronary supply to your myometrium. So if you remember this much. So now your muscles, the myometrium is basically your muscles, and the muscles do not get a lot of blood. So obviously, if they do not get a lot of blood, they won't be able to contract. So the contractility goes down. And if the contractility goes down, then obviously your heart will result in MI. So that is one of the complications that I need you to know. Apart from that, you also know that if your heart is not being able to send a lot of blood to the aorta, to the body, then what is basically your heart going into? Your heart is going into a failure. Why is your heart going into a failure? Because your heart is not being able to pump enough blood. So there is heart failure taking place. So now if you know this one thing, there's this one term which is basically, if you read your textbook, it is known as ejection ejection systolic failure. So what happens? Now I'm going to explain you what is basically a systole and what is basically ejection term. What does that ejection fraction mean? It is actually known as LVEF. So I'll be explaining you this, and I'll be explaining you systole and diastole. So if you understand these two terms, your entire pathophysiology is very, very simple, right? So now if you want to know what is basically systole, so now according to that, if normally you know that so like let's come back to this diagram. So you know that your heart is basically there is this superior vena cava. So there is superior vena cava here, inferior vena cava here. All this blood is coming into from here and in here and going into this. So your right atrium gets the blood, and over here you have the pulmonary veins. Oh, nice. So the pulmonary veins are coming from your lungs, and this is coming from your body. Both these people are getting in blood into this. So as you know, this is like a deoxygenated blood, and this much over here is like an oxygenated blood which is coming into this, and this is happening during diastole. So why am I saying that this is diastole? Diastole means relax. You want to relax. Now the terms systole and diastole are basically referring only to the ventricles. So when I want to explain something, I refer only to the ventricles. The atriums do not have any, the atria do not have any role over here. So if I say ventricles are relaxing, that means it is in diastole. And when I say that your systole, your ventricles are contracting, meaning they're contracting like this and like this, like this, like this. They're basically contracting to push the blood. That means that you're in systole. So it's very, very simple logic. Okay, so now that this part is clear, during this diastole phase, the atrium and the left and the right atrium both get filled with a lot of blood coming, and then they start contracting. So the first phase, what happens? They fill with blood, they contract, and obviously where do they push the blood? They push the blood obviously to the ventricles. So now the ventricles are the one which start getting these ventricles are the one which start getting the blood. So that is the third phase. And now what do these ventricles do? See, now right now the ventricles are in relaxation, but as soon as ventricle gets filled with a lot of blood, now let's say it gets filled almost with like around this much blood, and now they get filled with this much blood. So I have a lot of blood in me, what am I going to do with so much blood? They push in all that blood into the respective pulmonary artery and to the respective aorta. So as you see that the left ventricle and the right ventricle will be pushing the blood into the pulmonary artery, into the aorta, and this phase of when the ventricles are basically pushing into this is because they are contracting. And if they are contracting, as you already know, that it is known as the phase of systole. So as you've understood the diastole and systole phase, now let's come to our pathophysiology. As I told you that this valve is basically very, very narrow, and if this valve is narrow, it's not been able to push the blood from the left atrium to the left ventricle. So now this during diastole, the blood is supposed to be pushing as you know, the atriums are supposed to be contracting. So they push the blood. During diastole, they will be pushing the blood. As you know that there is not enough blood going into the left ventricle, so they get less. Then this all happens during diastole. So as you know, there will be basically a turbulence. Because why is there a turbulence? Because the blood going to the ventricles is very less, and hence it's like, if you have a very streamlined flow of something, it is very smooth. But if you have a little like, it's oozing out, like very few droplets are coming in, that is known as like a turbulence. So you will hear a murmur. Once you get into the depth of it, it is basically known as it's a very abnormal sound, which is not something that you normally hear. So that is very abnormal, and you're not supposed to be hearing, but this is heard during a diastole. So this is their basic pathophysiology, that your blood is not being able to send blood from the left atrium into the left ventricle, and hence if the cardiac output goes down, it results in fatigue. The patient over here will come to you with complaints of fatigue, dizziness, palpitations. Probably anything can be possible with this patient, but this patient will be very, very fatigued because of decreased cardiac output. Very huge complication is that it could result in MI. Now there's this other thing that you need to